Welcome to the panel Science Advice and Outreach During a National Emergency. My name is Andre Picard. I'm the health columnist at the Globe and Mail, and I'll be the moderator for today's session. The COVID-19 pandemic has generated unprecedented interest in science. It's also generated a disturbing level of distrust in science. From decision makers seeking evidence-based policy advice to the extensive media coverage of vaccine research and the loud voice of conspiracy theorists, science has become part of our daily discussions in Canada and around the world. Today, we've gathered some leading experts to discuss the challenges of providing advice to political leaders and to the public during a global emergency. We'll discuss how to best communicate scientific information when talking to the media, and our panelists will share their experiences and lessons learned in breaking down the latest research and communicating not only to politicians, but the public and even their own family members. So let me introduce our distinguished panelists. I'll present them very summarily because if I read their full bios, we won't have time for a panel. So I'm going to give them all Twitter-length bios, and we're going to spend most of our time talking about the issues rather than each other. So I'll start with Dr. Irfan Dalla. He's Vice President and General Internist at Unity Health Toronto. He's an Associate Professor at the University of Toronto Faculty of Medicine and a member of the Chief Science Advisors Expert Group on Health Systems. Welcome, Irfan. Next, we have Dr. Joanne Langley. She's a pediatric infectious disease doctor, professor and head of infectious diseases division at Dalhousie University in Halifax. She's the CIHR GlaxoSmithKline Chair in Pediatric Vaccinology, co-chair of the Government of Canada's COVID-19 Task Force, and member of the Chief Science Advisors Expert Panel on COVID-19. Welcome, Dr. Langley, and your many, many hats. Now, next is Dr. Carolyn Colleen. She's a mathematician and epidemiologist. She's the Canada 150 Research Chair in Mathematics for Evolution, Infection and Public Health at Simon Fraser University in Burnaby. She's a member of the BC COVID-19 Modeling Group and a member of the Chief Science Advisors Expert Panel on COVID-19. Welcome, Carolyn. And last but not least, we have Dr. Mona Niemer. She's the Chief Science Advisor of Canada, a member of the leadership group of the COVID-19 Immunity Task Force, ex officio member of the Government of Canada's COVID-19 Vaccine Task Force, and a member of the Variants of Concern Scientific Advisory Council. So welcome, Dr. Niemer, and welcome to all the panelists. I'm exhausted just reading all the things that you do COVID-19 related. So thank you very much for taking time out of your busy schedules, battling the pandemic to be with us here today and to share your knowledge and your expertise. So I thought, before we delve into some of the challenges I alluded to in the introduction, I want to start with something positive, and hopefully in an hour we can end on a positive note as well, so we don't depress people too much. We may do that in between. But I want to start by asking each of you just very briefly to give me an example of something we've done right. What's a really good example of good science communication in Canada during the pandemic? Irfan, maybe I'll start with you. I introduced you first, so I'll put you on the spot.
Thanks, Andre. I haven't had a chance to prepare for this question, but off the top of my head, I think one of the things we've done really well is communicate clearly how effective and safe vaccines are. And that's reflected by very high vaccination uptake. I think in many provinces, we're close to 90% now for first dose. So, amongst the highest countries in the world. And, sometimes I think particularly people who are on social media or even, watching the news or reading the newspaper, it can feel like there's always a conflict and, we're always presenting both sides of the argument. But the fact is that we've obviously communicated to the general public well enough that, 90%, roughly 90% of eligible Canadians have had the vaccine, and that's a huge success. And that's why in so many provinces, we're in such a good place right now in the pandemic.
Great. So that's fairly positive. I know some of us do spend a little too much time on Twitter, but I will stand guilty for that one. Dr. Langley, what's a good example for you? You've done a lot of communicating with the media. What's a good example of science communication during this pandemic?
I would say one thing that sticks out for me is the written communication that's been provided on government websites about the actual state of affairs. And not every government has done this really well, but Public Health Agency of Canada, some provincial governments have updated the data on a regular basis, even as much as daily, about how many cases there are, how many are in hospital, how many vaccines have been given, what's left to do. And that means that we're all kind of singing from the same song sheet, whether you're an expert or a member of the public, whoever you are. This is the same data that we can all speak to and identify what the challenges are that are ahead. I know that's tremendously difficult to do, and there's never been an outbreak, or I think, where that's happened so quickly. And I know it requires 24/7 staff to do that. But it really, in my view, is a very valuable way to share information and make sure that people have the right evidence.
Yeah, we do have good data, lots of numbers, but maybe we talk about this later, but maybe we're a little too obsessed with the numbers in the media anyhow. And we have to wonder if people actually read government websites, but you're right, they have done a good job. So we'll come back to some of that stuff. Dr. Colleen, what's a good example for you? You're a math person, maybe the numbers interest you as well.
I do read the government websites, I have to say, so you've got at least one reader there. And I think the scientific community and the medical community read these numbers, so I think, and they are part of the public and also talking to the public. So I'm going to go right back to the beginning of the pandemic for my example and talk about flattening the curve, because I think that was something that really was conveyed extremely powerfully. And we don't have the capacity nor the desire to really enforce social distancing measures. That was really something where Canadians worked together. They really understood, I think, the collective nature of what needed to be done. And they understood that we had this grave threat. And I think the concept of flattening the curve, in the end, we didn't so much flatten it as prevent it from happening compared to those initial communications. But we had lots of conversations where somebody would do this to suggest the flattened curve. And I think we really did convey the importance of all of those individual actions taken together that collectively made a huge difference throughout the part of the pandemic before we had vaccination.
That's great. I haven't heard the term flattening the curve for a while. You're making me nostalgic to March 2020 or something. I'm not sure if it's nostalgia, but brings me back. So we can come back to that too, about some good terminology that people hang on to. So finally, Dr. Niemer, what's a good example for you of good communication during the pandemic?
Well, I have to say that I think what we managed to communicate well is the importance of science. And actually, we managed to communicate some pretty complex scientific terminologies about immunology, about PCR testing, about variants. I mean, it's pretty incredible when you think about it that your average Canadian, these are things that are words that have just like become household names for them. So I think I would say that's probably sort of maybe the best upside to in terms of communication during the pandemic.
Yeah, it's true. We do use terms like mRNA, just they roll off our tongue now easily. But then we're all epidemiologists now. I think we're all experts. So that's I'm not sure if that's a positive or a negative. But so I want to flip that question around. I want to go back to each of you and say, what's the one thing that you think was a big failure or that made you the most angry about what we communicated? So maybe I'll go backwards. Dr. Niemer, I'll stay with you. What's the one thing you just said, oh boy, we flopped on that one?
There was I think at the beginning of the pandemic, there was a general approach to underestimating the population and perhaps more of a paternalistic approach to communication, which did not necessarily serve us well, because we've had to flip-flop on many things, on masks, on a lot of the non-medical public health measures, testing. We've told people so long that antigen tests and rapid tests are inadequate, that now we can't get them actually to take those tests. So I think that we could have done a better job in terms of assuming that people have an appetite for understanding better, and just like having more transparent communication about knowns and unknowns.
Great. Dr. Colleen, is there one that sticks in your mind that you say, oh, I wish we had done that differently?
Yeah, I really agree with Mona on this one. I think that that's completely right with rapid tests and masking and things. The one that really stands out for me is I think in a way we did such a good job of conveying the difference in severity by age and conveying the importance of distancing and protecting the elderly and protecting the vulnerable, that then we had a lot of people thinking, okay, well, I'm 25, this is not severe for me, and it's okay if I get COVID almost, and not taking those risks seriously. And the fact that those risks are much less in younger people than they are in older people doesn't mean that it's okay. It doesn't mean they're low enough that we could let the pandemic roll unbridled through those younger age groups and not have a dire problem. And I think we did see that. So I think that kind of the difference in risk is real, and it's very important, and it's very true. It's very right. But I think we maybe accidentally left the impression that there isn't much risk in those who are younger, and there isn't much comparatively, but it's what that comparison is, I think, is really important. Much less than absolutely dire does not actually mean okay. And I think that's a point where there were negative impacts because we had failed to convey that even if you're 30, you might still have severe, long-lasting impacts from COVID.
Yeah, I think that's a good one, that the public often saw these things as binary, not as a gradient of risk. So yeah, that's a good point. Dr. Langley, what's the one that made you crazy in the media or elsewhere? Oh, your mic is off.
The issue that I struggle with, that I think we have a lot to learn about, is being able to communicate information or advice to the public about what we need them to do now, and yet also be clear that there is uncertainty and that this is a dynamic environment of new knowledge generation, and so advice could change. And that does not mean that the speaker is any less credible or less worthy of your trust, or that you shouldn't have confidence in them. So I think, how do we get to a place where we see science as a learning environment, where because you're constantly learning, the recommended behavior will change, and that's acceptable. And I expect there are many, all of us have trouble, I think, in some aspect of our life with change, but how do we get to the point where we accept change as normal and not something that should cause you to be fearful? And the particular environment of the pandemic is that everybody's scared. It's not like recommending childhood vaccinations and we're going to change the 8-month dose or something. Everyone is scared all the time, even if they don't admit it. So that would be the thing I think we have yet to work on.
Right. And Dr. Dalla, what's the failure you saw out there?
I would echo my colleagues' comments for sure, particularly regarding uncertainty and being a bit paternalistic about what we know and what we don't know. Another area that stands out for me, and this goes back to something I think most of us are told as children, is that actions speak louder than words. And I think repeatedly during the pandemic, we've seen leaders, in almost every province probably, and at the federal level, say one thing and then do something that goes directly against what they're saying, whether it's related to travel, whether it's related to social distancing or masking or gathering limits. And, those actions are a form of communication themselves. And in many instances, I think they have undermined the messages that we have been trying to communicate to the public.
Yeah, it's a tough one to communicate. Dr. Deemer, you used the term flip-flopping. It's one I hear a lot from my audience at the paper. How do, and Dr. Langley alluded to this as well, that science evolves and sometimes the rules change rapidly. So how do you communicate this? How do you communicate that change is normal? It's not flim-flammery, you're not making stuff up. How do you communicate that really difficult message to the public?
Well, I'm not going to say here that I'm any expert in communication. Andre, you're more versed on this than all of us. But it's always been my my sort of view that we need to communicate the scientific method to the public. And I think once the scientific method itself is understood, then it makes a lot of things much easier. because, people will understand things about, extrapolations, about controls, about rigors, about interpretation versus the evidence itself, and so on. So I wonder sometimes if one of our ongoing challenge, and one that I suggest we need to tackle in the coming months and years, is really to increase science literacy and explain the science method to the general public and the politicians alike, I would say.
But it's hard to do that. It's hard to communicate method when you're communicating on Twitter or in a newspaper headline. People want the real essence, and they want it boiled down, and they don't want things to ever change. So that's difficult.
It is, and this is why we have to do it in peacetime, so that when there is an emergency or when there are decisions that need to be made, we don't need to, to be explaining the method and the result at the same time. But maybe it's wishful thinking on my part.
Okay. And Dr. Langley, you alluded to this as well, this challenge of things changing. Talk about, do you have some dealings with politicians in particular? How do you, I know they pull their hair out when they hear the rules are changing. How do you communicate to them that this is necessary and it's essential?
It is very much the same thing. At least you have an audience one-on-one where you can have a to and fro when you're communicating with the government or politicians. I find in media, though, as the speakers, the person being interviewed, you have very little control over what actually comes out of that exchange. And the best is when you have a live interview, because you can actually say, and they won't cut out the little word bite. So that has been a real challenge, I think, in the pandemic, is snippets and headlines coming out of a whole conversation. And that's the message that goes across to the public. And it can really drive behavior, unfortunately.
There's some politicians calling for advice right now, live. So I see you're in great demand. But how do you do that part where I know it's frustrating, but how do you make sure that you get that essential message? You've had a lot of practice doing it, but it takes practice, right?
It does. And I think, some of the very basic media training that you get, I find very helpful. So thinking ahead of time before you have the encounter, what are the most important things going on in that 24 hours that the public might want to know about? Formulating what your ideas are about them, and kind of thinking of this higher goal of how can I convey the truth, but the positive aspects of our situation that are reassuring, that offer optimism. So, we can always come up with something negative quickly, but what is the greater goal here in this communication? It's helping people understand. And so that may mean saying the same thing over and over sometimes in an interview.
Yeah, we say in our business, you don't play a hit record just once. So it's worthwhile to repeat things over and over. So Dr. Colleen, you're an epidemiologist. I said half jokingly earlier that everybody's an epidemiologist now. But how do you deal with that, where everyone is giving their interpretation of the numbers? I imagine it makes you pull out your hair sometimes, some of the interpretation you see.
Yeah, so I don't have a card that I carry that says epidemiologist. I have some background during my postdoc time at the Harvard School of Public Health, but I'm mainly a mathematical modeler, and I do work in genomic epidemiology. I think these are great questions, and I think what Mona was suggesting about conveying the scientific method maybe could be, I think it's a great goal, and as you say, a longer term goal, but maybe just conveying the idea that we are learning, we are all learning. The scientific community is learning, and sometimes that learning is slow because it takes time to do studies, and the time scale that decision makers maybe need to understand something is fast, much faster. They want to know, they want to make a decision this week or next week. They don't want us to say, oh yeah, you know what? Give me some funding and I'll go away and I'll hire a student, and then in 2 years we'll know the answer to this question. It's not a good idea. So I think that the public has learned a lot. The decision makers need to learn. The scientific community needs to learn, and the bridges need to be built so that information can be conveyed across as effectively as possible. And I think we've been trying to build those bridges in the pandemic between the scientific community and policymakers and public health experts, and we need to reinforce those bridges and make sure those lines of communication are rapid and are clear, so that when the scientific community has, they may not have consensus among them, but I want to take rapid tests as an example. Clinically, they're not the diagnostic test that a PCR test can be, but they may have a function as a public health screening tool that is a different thing than a clinical diagnostic test. And there are also uncertainties about false negatives and false positives. And there's this sort of complex picture, much of which hasn't actually changed that much in the past, say, 8 months. But perceptions have changed, perceptions of the need. What's the comparison? Are you comparing rapid testing of the close contacts to PCR testing of the close contacts? Are you comparing rapid testing of somebody who's about to go and visit a vulnerable adult in a long-term care home to no testing? Like, those are really different comparisons. And I think having those communication bridges as we learn about like how to define the question we're asking, what is the purpose of this test? What are we using them or not? Using or not is not the right question. Using them for what? In place of what? In place of doing nothing or in place of doing PCR testing? I think these bridges can help not only convey that the scientists are learning, but also the public is learning as we go along, and decision makers and those bridges are learning too. And so we don't necessarily flip-flop, but we change the purpose of what we're trying to do. So we have these tests, and we're gonna use this for a new purpose. Similarly with masks, is the purpose to protect a healthcare worker facing a patient today, or is the purpose to protect a community using a grocery store? The need for masks is different because the purpose is different, and not so much that the science method changes, but that the questions we ask are shifting and they're fast. And I think conveying some of that learning is a possible route through this.
But some of these things can seem complex to the public. For them, a test is, well, they're sticking something in my nose. They don't know the details of what goes on in the lab or why it's being done.
But I do think, the public, many of us have done a home pregnancy test. I think the public are aware of tests that are used for screening. We've all been asked, have you had COVID-19 symptoms? Please don't come into this venue if you have symptoms suggestive of COVID-19. We know that screen is what it is. We know that it's a free thing we can do ourselves that is not perfect as a tool for COVID. And so I think that gets back to kind of, are we going to underestimate the public? I think the public has become very interested. I never would have imagined as an infectious disease modeler that herd immunity and R naught would be just common parlance in the households of Canada, and all the things we talked about in the community of when the pandemic comes, or is it going to be what's the next H1N1 or what's the next MERS. R naught is a household phrase. It was never something that we imagined. And I think the public cares and can understand these things. I think it's our job to help convey them to decision makers within our communities of researchers and thinkers, but also to the broader society.
Yeah, we do have a new pandemic language, that's for sure. Dr. Dalla, how do you deal with this ever changing? The rules are changing. How do you communicate that internally in your institution and again to the public, which you do a lot of?
Good question. I think one thing, those of us who see patients have sort of always been taught to be honest with patients, tell a patient what you know about their, clinical condition, and also what you don't know, and then outline what the potential paths forward are. And I think we try to do that in our own institution with our own staff and physicians and learners. And I think the most successful communicators to the public, and some of them are clinicians and some of them are not clinicians, have kind of embodied that same principle, always going back to what we know, what we don't know. Here are potential paths, some potential paths forward, and here is how we will change tack depending on what happens. And I think probably we all agree that a lot of times the mistakes that have been made with respect to communication reflect an underestimation of, first of all, people's intelligence, and secondly, people's willingness to hear uncertainty. And I think whenever we tell ourselves we need to control the situation entirely and convey that there is no uncertainty, whether we're doing that with an individual patient or whether we're doing that with the public at large. That's when we make mistakes. We've all heard physicians, for example, stories about a physician saying to a patient, your prognosis is X, and then the patient outlives their prognosis by 5 years or something like that. And, most physicians have made mistakes about prognosticating, and smart physicians try to, make that mistake once and then learn that, well, I will never prognosticate with so much with so much certainty again, unless I truly am certain. And I think similarly, when we communicate to the public, the more we can be honest about what we know, what we don't know, the better off we'll be.
And I have the pleasure of sometimes going to speak to new medical students, and I always tell them the three most important words they should keep in their vocabulary is "I don't know." Do you think that we haven't said enough of the "I don't know" during the pandemic? Because there are a lot of unknowns.
Yeah, absolutely. I mean, going back to what Carolyn was talking about at the beginning with regard to flattening the curve, that was a very useful metaphor. But I think we also conveyed that it was 2 weeks to flatten the curve, and conveyed the message that we were all going to be back to normal in 2 weeks or maybe a month or two. And actually, when you talk to public health physicians, infectious disease physicians, modelers, many of them knew that it really wasn't going to be back to normal in 2 weeks. But somehow we weren't able to convey that message to the public that really we didn't know what was going to transpire over the coming months and frankly, years. And we're still in that situation today, a year and a half into the pandemic, where I think it's probably fair to say that the next 6 to 12 months, there's still a fair amount of uncertainty. Are we going to go back to the situation that we were in the spring of 2020? Almost certainly not. We can convey that message with certainty, but are we going to, are we sure that we are going to be able to get rid of masks by the spring of 2022? I would say we're not sure about that.
Well, at least your premier is sure, so we'll see on that one. Now, Dr. Niemeyer, in Canada, we have a particular, we can't talk about health without talking about the Constitution, but we have these weird jurisdictional battles, and we have dramatically different policies in different jurisdictions sometimes. Does that make it more difficult for scientists? Because people get the impression that, well, you can just sort of pick and choose what you want. Does that make it more difficult for you to do your job?
Well, I'll tell you, it makes it more difficult, as I learned, because I didn't think that science had to follow the Constitution, that science was the same across the provinces and territories. And, I guess your associate in a, at least for the politicians, you have a label, federal or provincial. And if they don't like what you're saying, then, it's the feds getting involved and so on. I think this was an unfortunate thing. And I'll tell you why, because many of, there has been a great mobilization of scientists, of researchers across the country. And, the example of my esteemed colleagues here is but one of them. But in every case, they've had to more than double duty in terms of science advice, both at federal and provincial level, and sometimes at local levels, and then do, of course, their daily job as physicians, as researchers themselves, and mentors. So we have unnecessarily, complexified things in the country when science was really the same. And it's after what the politicians decide to do with the information, that differs. And we elect politicians, I guess, to make those decisions. Of course, in a pandemic, people, would say that it would have been much simpler in terms of communication as well, if we all stuck to the same principle. Like if we all knew that when numbers are that high, this will get done. We may not be at the same level in the different provinces, but at least we know the consequences, or the way this is rolling out is going to be similar at different times. Because it wasn't, it just led to a lot of confusion, which I guess fed on a lot of the conspiracy theories as well.
And is that coordination, is that possible, or is that just a pipe dream that we could do that?
I hope it's not just a dream, because like the scientists, when we sit around the table, whether it's a federal table or provincial table, the science is the science. The conversations are the same. It's what happens with the advice or with the output that differs. So I'm certainly hoping that once we put the pandemic behind us, because we are going to have other crises, not just pandemics, and other mobilizations, I mean, other, urgencies and emergencies for the country. And if we can put in place a sort of, science advisory system that serves the entire country, I think that, it would be in the best interest of all Canadians, and certainly of science as well.
And Dr. Langley, I can see you smiling there. The jurisdictional issues are something that you have to deal with in your daily work. We don't even have a common childhood vaccination schedule in Canada. How frustrating do these jurisdictional issues get for you?
It is frustrating, and I think what Mr. Picard is referring to there, Dr. is referring to, is the idea that we have 13 little countries with different immunization programs in Canada. So that predated the pandemic. I think there obviously is a kind of a destabilizing role of multiple jurisdictions in the same country doing different things with the same advice. What seems to have happened, to my estimation, though, is that the provinces or the jurisdictions that followed the scientific advice, that had the humility to bow to what scientists were recommending, did better than the ones who felt they could determine in another way what the best path forward was. So, from a government point of view, that requires an understanding of science. It requires a humility. And granted, they do have to balance things other than health, but ultimately, everything is so integrated. As one ICU physician said on Twitter during the pandemic, dead people can't open their business, or some paraphrase of that, like dead people can't go shopping. So it's all integrated. Our health is just intertwined with every other aspect of our life on the planet. So I think moving to that kind of view of the world, that health is so important, is a possible goal. And I'm as optimistic as Mona is about this improving over time.
But as a scientist, how do you want policy to be science based? But realistically, at best, it's going to be science informed. There's going to be politics in there. How do you kind of, bite your tongue and say, well, I guess there's politics here? Do you have to do that as a scientist?
Well, I think that there are places in the world where politicians do have that much higher interest. And that it will not be, when we talk about political, it means different things to different people. But I think it's possible to govern a country or a jurisdiction and have the best interests of the people in mind all the time.
Okay. Now, Dr. Colleen, I know you want to jump in on this one.
Yeah, so I wanted to bring up, the British North America Act was in 1967. This predated the discovery of viruses at all. This largely predated the germ theory of disease, and certainly predated flying from Ontario to BC and from Alberta to Quebec and so on. And so I do think there are these jurisdictional challenges. And for us as scientists, I think one of the big pain points is data sharing and data coordination. Not necessarily sharing data with the public, because these are sometimes private healthcare data that can't be shared publicly. But I want to think about this in the context of uncertainty, because we talked about conveying how important it is to convey what we don't know. And I think there's some huge unknowns in the next year for where this pandemic is going. We all have heard about endemic mode or the endemic state. And I think we've realized that we don't get to declare whether we're in endemic state or not, because we want to balance factors, or we want to, we need to be there, which indeed we do. But I think if we want to think about the things we don't know and how they will shape that transition between endemic or pandemic, sorry, to hopefully a manageable, low level, better world where COVID is not such a big problem all the time, we need to understand some things. We need to understand how immunity wanes. We need to understand the efficacy of our vaccines against the virus population that we have. And in doing that, we need to understand how the virus is evolving. And we need to understand transmissibility in our reopened population. And these things need, because we have unique populations in Canada with close links to a lot of parts of the world. We will be getting viruses from a lot of the world, but we also have our own mix of vaccines that we've used and dose intervals that we've used. And so we need to be looking at how we can learn more about those unknowns. And, do we want to have people in BC can see BC's data and people in Quebec can see Quebec's data? Or do we want to have a system where we actually can combine those and get the power of seeing the same thing happen in 3 different jurisdictions and knowing that it's the same in the 3 places is so much better than just seeing one thing that you could say, oh, well, that's not really very significant. That's just a one-off. But, having that combined power is important. So I think in conveying those uncertainties, we should also be thinking about what can we do to resolve those uncertainties. And we could do it what could we do today? What could we do tomorrow? What could we put in place for next year so that even if it's unlikely that this virus evolves in a way that threatens our current pandemic measures, our vaccination as the way out of this, that we will know in time. And I think that's, you asked about the federal provincial coordination aspect. I think that's been a real challenge in Canada and in other kind of federal style jurisdictions of pulling those, different states or different provinces together to get that joint picture.
Yeah, I often like to remind people there's no constitutional impediment to cooperating and to talking to each other. So we can always do that.
But it feels that way sometimes.
Yeah, absolutely. Now, Dr. Dalla, you, like me, spend a little bit of time on Twitter. You are smarter than me, so you spend less time. But this is a place where during COVID, we've seen some interesting discussion. We've seen scientists fighting it out on Twitter. I'm interested, and this can be confusing for the public. You have 2 leading scientists with 2 polarly opposite views. Is that good or is that bad for science? Should they not be doing that?
Probably both, a little bit of good, a little bit of bad. I think, there are lots of people who think scientists disagree about everything, and Twitter can feed a little bit into that. But I think, as people on this panel have alluded to, on many issues, there really is a scientific consensus. Yesterday, I guess it'll be a few weeks till this airs, but yesterday the FDA's advisory panel voted on voted to recommend vaccination for children 5 to 11. And I think the vote was 17 in favor, 0 against, with one member abstaining. So that's an overwhelming consensus. And now inevitably, we're probably going to see this play out on social media and in the media, in the traditional media, a little bit as a sort of, here are some experts saying you should vaccinate your children, and here are a few other people who are really hesitant or reluctant. And I think that's an area where, we probably all need to do a little bit better at conveying the overwhelming consensus that scientists have. On the other hand, there are areas, and Dr. Niemer talked about rapid testing as an example, Dr. Collane as well, where there are reasonable disagreements, often on pretty subtle points. And I'm of the view that it's fine, it's good. The public sees, these are the areas that scientists don't necessarily have 100% consensus on. And in a mature society, I think people will be able to see these are the things that scientists generally agree on and that we should all be doing. And here are some areas where it's reasonable for people to have differing views.
And Dr. Niemer, I want you to expand on that a bit. Traditionally, scientists challenge each other. They're skeptical. They want to repeat experiments. Do we have to change that approach in this social media world where people see that doubt as undermining the message? Do we have to communicate it differently or do it differently?
I think that, I agree, we have to do it a little bit differently, because if I take the example of vaccination, we say that the consensus is, or the majority is to vaccinate children. Then there are some who say no, but we stop there, and we shouldn't stop there. We should explain why. And I think this is the problem, because most of the time we fail to dissociate the evidence from the interpretation of the evidence. Because at the end of the day, when we're making this kind of decision, we're weighing basically risks, and there is a lot of unknowns that go in there, and a lot of value judgment as well. So I think the more we can dissociate the data from the interpretation of the data, the better it is. I know it may sound too subtle perhaps, but you don't want people just like walking around saying the vaccine carries the risk of thrombosis or of myocarditis. It's like, okay, and if that is the case, do we have solutions for that, or what are the consequences, if any, of those risks, and how do we weigh them?
And Dr. Langley, you deal with, you're a vaccinologist, this is your area, and this is one of the most emotional issues. It's vaccine hesitancy, people worried about vaccinating their children. How do you deal with that? Your knowledge that these are really good vaccines, but there's so much doubt, and there's even some loud minority of anti-vaxxers even. How do you deal with that in your day-to-day?
Mm-hmm. So we see patients who have concerns about vaccines, and I find the most fruitful discussions are where you have the time to sit with a family, and you just hear what they're worried about, and you spend 20 minutes just listening to get an idea of what their concerns are, what they learned about, and then you have a chance to go to where they are and work with them to understand whether those concerns are valid or not, what we could do about them. And, I find most people that come to our clinic, there's a very small percentage of kind of conspiracy theorists. Most people are just very thirsty for knowledge, or are very science literate. And I think in general, the population is becoming more and more literate. It's an ever advancing population. And that you have to get up to their level. They may come in with an article that you haven't read yet, and then take the time to just work on it. It may take more than one visit. So, one doctor, do we have the time to do that for all the people out there? Probably not. So we need to find ways that there are more people that can have these kinds of communication, these high-level discussions, and really address people's concerns. So, but I find they're wonderful discussions, and people have really good questions. And mostly people just have a lot of information gaps that you can fill with when you have the time to discuss it.
And I often hear people say, well, meet them where they are. So answer their questions, but it doesn't seem like a fair fight. 20 minutes is a lot for a clinician. You're lucky if you have more than 5. And then they have 10 hours of Facebook. It doesn't seem like a fair fight.
Yep. And I think, and Dr. Niemer alluded to this earlier, and perhaps other speakers, the idea of how do we learn about science as humans, that we really should be integrating this into our curriculum from the youngest age. And there are some countries, I think, that do this. Cuba, for example, is one example where they understand immunization as they go through their schooling, and that leads to support for being vaccinated and wanting to get vaccinated. So our whole science curriculum, I think, is necessary. It's necessary to be a functioning human these days.
Great. And Dr. Colleen, another area where I hear lots of skepticism, lots of doubt is modeling. So modeling is an area, what do you say to the people who say things like me, like, well, the models are never right, they're always wrong? How do you explain the usefulness of modeling, for example?
Yeah, I think that's a great question. And throughout the pandemic, sometimes the models have really been right and sometimes they haven't. And often when they haven't, it's because a change happened, like a policy change was made. And we don't really, models are a tool. I think they're a scientific tool, and they're one of 2 major tools we can use to understand where the pandemic is going at the population level. The other one being thoughtful comparison to other places that are a little ahead of us on some trajectory. But they can't predict human behavior, and they can't predict decision makers' behaviors. And sometimes they don't try to predict, in the same way that when you use headlights on your car, you're not trying to predict the future. You're trying to show an obstacle. And so you see a moose in the road. And when you swerve or stop, you don't then say, God, I'm going to reevaluate this headlight because it did not predict the future for me. It said I was going to hit the moose, and I didn't hit that moose, and the headlight is wrong. You know, we often hear in BC that models are not crystal balls. And I guess my answer to that is, if you have a crystal ball, that's probably you should probably use that. Like, you don't need a model if you have your crystal ball. But other forms of inquiry are also not crystal balls. And I think modeling sort of in a way gets a short shrift, because you can make a picture that has time down there and can sort of look like it's trying to predict the future. And you know, your intuition model for what to do is a model too, and it also doesn't predict the future. It's just harder to put data beside it and go, oh, look, like this was in your projection, but this didn't happen because you didn't make that quantitative projection in the first place. Models, of course, have limitations and they make assumptions, but they're ways to put together our assumptions about lots of different aspects and synthesize them into a picture we can understand and query. And so I think they're really useful tools to synthesize all those different assumptions and explore what they mean when put together in that synthesis. They're not sort of failed crystal balls, but I think they are useful tools for thinking about what's important, what our knowledge about it means, where we have gaps that really change what the picture is. For example, if we think immunity wanes in 6 months, that's a really different picture than if we think immunity wanes in 2 years or 4 years. And what kind of immunity wanes? Is it the B cell immunity, or there's lots of technical details that you could go to, but that raises the importance of learning certain things. And I think it's an important tool. So it doesn't have to be a crystal ball in order to be a useful form of inquiry.
And I'll say too that we in the media tend to, the models often offer different scenarios. In the media, we tend to always lean towards the worst case. And I've gone back in a couple of instances, and the likely scenarios often do come true. It's the worst case that don't. So yeah. I'll say that not in defense of my profession, but against it. So how's that? So Dr. Dalla, let me ask you about a specific, the conspiracy theory. How do you deal with that? Because there's some wacky things out there during COVID, and they seem to be getting weirder by the day. How do you deal with the real extreme patients who say this, whatever, I need to use horse paste or whatever, because that's better than a vaccine? How do you deal with them?
I think that's a great question. I think there's probably, how do we deal with conspiracy theories at an individual level? And then how do we deal with them at a societal level? Dr. Langley talked a lot about, and you too, about just meeting patients where they're at, listening, addressing concerns one at a time, compassionately, giving people the opportunity to have dialogue, come back, and we don't convince everybody to get vaccinated on the first visit. Sometimes it takes 2, 3, 4, 5 encounters, and that's okay. That works at an individual level. At a societal level, I don't know. I mean, I'm not the expert. My thinking is the more we ignore the conspiracy theorists, the better. I think journalists have generally in Canada been a real force for good in the pandemic, and have been very good about, not feeding into the conspiracy theories and the misinformation. Sometimes I still feel that, there'll be like a ragtag group of a dozen protesters outside, a clinic. And why are we giving these folks so much attention when on the same day, 30,000 people have rolled up their sleeves to get vaccinated? And so sometimes I feel like the more we create a social norm that the vast majority of people are following the science, doing the right thing. We talked a little bit earlier about communications, and one thing I think that we haven't done so effectively is really rely on professional communication firms. I would have loved to see some really well-funded communication campaigns that use humor and other methods to really get the message out there that here are the things we want the public to do. Like 99% of physicians are vaccinated at this point in the pandemic. And I think that's a message, a very simple message, for example, that we haven't really gotten out there enough to just reassure people who are still inquisitive or hesitant that, your physician feels this is safe. They've gotten vaccinated. They've probably encouraged everyone in their family to get vaccinated.
Dr. Niemeyer, I want to ask you to build on that a bit, because you alluded to it before that I named all these groups that all of you belong to, and most of this is volunteer work. You do it on top of your scientific work. Do we not support scientists enough with the communication part? Should we be doing like Irfan said and giving them some professional communication help?
I completely agree that, historically, we haven't supported scientists and researchers, whether in our universities or in government, in terms of public speaking, whether they're talking to journalists, to the media, to children, etc. And I think this is essential, and this is certainly a big takeaway from this pandemic, that the public wants to hear from the scientists. So you do actually have a public who wants to hear you. And you better, do things properly. Like, you wouldn't improvise as a doctor, and you shouldn't improvise as a communicator either. So I really hope that this is going to be something that's, taken seriously and also valued by the institutions, because this is part of being a scientist, is to communicate, to disseminate knowledge. And disseminating knowledge is not only in Science and Nature and the New England journals, although we all love to do it, but the impact at times is much higher when you're properly communicating with your own neighbors and your own public.
And Dr. Langley, I'm sure you have some interesting views on this, that this is high stakes stuff you do now. Do you need more support? Do you need more professional communication help?
Mm-hmm. Yeah, I also see it as very important, and that it is that knowledge translation and dissemination step of the work that you have done, or that broadly speaking, the scientific community has done. So I think it is very important that it's valued. I think we need to learn about it during our training. And that when there's a day of interviews, that there should be someone there who's kind of summarized what the big issues are out there in the media today, what the key kind of discourse is that you could address. I know personally, I don't really have someone who can do all that. But I think universities, at least where I'm based, are starting to recognize they do need to provide that support. But I don't know very much about that area of expertise. But it's clearly very, very important, because there's so many of us that could be speaking, and we all need that guidance, help, and to develop some capacity on our own to do this kind of communication in an effective way.
And you mentioned you didn't really have training in this in your era. Do you do this voluntarily? Do you do it reluctantly?
Yeah, so when I was chair of the National Advisory Committee on Immunization, the Public Health Agency actually gave me some training. They hired an organization. So I had a day of that. It was invaluable, really, because it was a professional science communication organization that was giving me the training. And now, I really try and see it as knowledge translation. And when you get calls on a day when you've got 100 other things to do, to just kind of reorient yourself and say, this is what it's for. It's communicating what we know to the public, and that is an important thing to do. So that's the way I try and see it, but sometimes it's hard, especially when the really difficult time is when it gets political, like when they try and say that for some reason, you hold that view because of some ulterior motive, which, if you haven't faced that before, and certainly that was new to me in this pandemic, to face that kind of attack is hard to deal with.
Yeah, anyone who supports vaccination suddenly becomes a pharma shill or whatever. These are just attacks that are hard to counter. All right. Now, Dr. Colleen, I want to ask you the same thing. You're a mathematician, and I don't imagine they trained you on how to communicate with the public.
No, there was not a lot of media training. I actually did my PhD on quantum physics, and I moved into infectious disease after that during my postdoc years. I think it's really important to do this work, and to echo what Joanne was saying, I think, we are mostly in Canada, we are publicly funded as scientists, and then the pandemic came, and I feel like it is part of my role as a publicly funded scientist to do that work of communicating with the public when there is an audience, like you say, that we do have a public right now who wants to hear from scientists. We have journalists who know that, and that's why they want to interview us. And I think it's important. I also think it's important to have balanced and calm and Canadian voices and a Canadian media that has Canadian scientists, because the media from other countries, and obviously our neighbors to the south, can be influenced by different political forces than our own, and can have that influence on the public that maybe we don't want. And so I do think it's important. It is a lot of time. While we've been talking, I've had 3 or 4 emails come in about a modeling report we released this morning, just about asking for interviews. But I do think I think we can consider it as part of our role as publicly funded scientists to meet this very important public need. And it does take time. I think in terms of supporting it, it would be great. I think that direct training that you mentioned is potentially more useful than universities having their spokespeople. I think people do want to speak to scientists rather than to press offices at scientists' institutions, although those people can be great and they have certainly a role. But I think us being able to directly communicate with the public is important, and it is challenging to learn to do. And I think we should probably be doing it better. It's also something most scientists most of the time don't need to do. If I write a new modeling paper about a new statistical method for inference of blah, blah versus blah, 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 pretty much by and large, that's not an urgent public matter. Whereas in the pandemic, it's a very special time. And I think that resonates with this question. I also think it's important to convey maybe to the public that scientists have put in so much extra time. This is volunteer work. These are not people who are getting paid by the whatever industry, the media, the pharma companies, to promote the message, or their institutions aren't saying, okay, here's another $100,000, go do 10 interviews a week. That's not how this works. This is really people who care, and that's why they're trying to do it. I think it might be good to convey that. I don't know if that would increase trust or make us all look like we do free work, but I don't know how that goes. But I think we do it, and we value doing it.
Would certainly make your life easier. I don't know about the rest, but Dr. Niemer, before we're running out of time, but I want to come back to a topic I know you're very passionate about, and it's how do we make the public more science literate? So where do we start on that important question?
It is a very important question, and one that is frankly of national importance, just like for our democracy, as we've started to see, as we'll probably likely continue to see with other big challenges that are facing us. So I think that Joanne suggested already that we need to look at our academic institutions, whether at school or at universities, and you just wouldn't accept that someone that is scientist wouldn't know about, the major painters and philosophers of the time, and it should be the same, vice versa. But rather than, teaching the old ways, I think if we were to adopt a, learning through problems, problem-based learning, I think it would make it so much more interesting. It would convey right away the multidisciplinarity and also the why do I need to know. Of course, if you start in school, it's great. And then if you move on to universities, it will really help remove all these barriers between disciplines and requirements and not requirements, suggesting that this is maybe a nice to have and not really something that's an essential, part of your individual and your collective life as well. So I would definitely start there. But I think in the meanwhile, of course, the scientists and the journalists have, I think, a great role to play. And we do need to ride on the appetite of the public for knowledge and for science, and really, double down on it over the coming years.
And Dr. Dalla, you have youngest children. Do you think that younger generation is being better equipped to deal with, you know, the internet world with all the conflicting evidence than us older folks?
I think they are. I mean, at least based on my observations of just my own children, I think they are being pretty well educated on being able to figure out what's true and what isn't true, and also, you know, how we, you know, the scientific method is basically the sort of search for truth, right? How the world works, and sort of, you know, getting that basic teaching about how we figure out what's true in the world. I'm actually pretty impressed with the teaching that, with the education system that, you know, our kids are exposed to. So I am pretty optimistic. We have a highly educated populace, and hopefully, as Dr. Langley said, it's just becoming more educated with each successive generation.
Yeah, and I remind people that the spreaders of misinformation are actually my generation. We're the worst on Facebook. People who were around before it existed, we don't know how to use it as well. As young people are much more skeptical and much more savvy about this stuff, which is good. So we're almost out of time. So I want to ask each of you, I always like to end a panel on a positive note if I can. And a future-looking note. So I want to ask each of you, you know, looking forward, I hate to utter the words, the next pandemic, but when the next pandemic comes along, how are we going to do things differently and better? And are you confident that we will? I guess I'll start with you, Dr. Niemer, if I can. Do you think we'll do it better the next time? Have we learned?
Well, it's going to be up to us, and I sure hope that we will do it better. I think that it's going to require a number of things, starting with our data system and data sharing. I think that we're going to need to, you know, to use the coming months to just fix what hasn't worked or what wasn't up yet. So I think if we can manage to work with each other, to share data, to communicate better from the get-go, transparently and thoughtfully, I'm certain that we will do much better, because we're going to empower the public with the ability to make decisions for themselves. They won't need to wait for government to tell them whether they need to put a mask on or to socially distance. They will have this, and they will also have home tests, and they will all be produced in Canada as well. So I think we're going to be better equipped.
Great. Dr. Langley, do you have a similarly optimistic outlook for the next time?
I do. I think we will do better. I think we're at a moment in time where really we have a consciousness of our selves as part of a global system. And that has led to the development of so many scientific collaborations, networks, surveillance systems. I mean, the COP meeting that's happening is about the recognition that we share the same environment. And there are many things that are local, but there are also many things that we have to deal with on a global basis. And I'm hoping that recognition will take us forward to better early recognition systems and planning systems that will help us for the next one when it comes.
Okay. Dr. Colleen, do you think we'll do better the next time around?
I certainly hope so. It can be a bit disheartening to read some of the lessons learned documents from SARS-1 that raise some of these same issues. And I hope that we can establish structures that really give us institutional memory, because, you know, there's some risk, and that's kind of what keeps me up at night, that we get an immune escape COVID type that, you know, the next one is actually whatever comes out of Delta in the next 8 months or 2 years or 1 year. But if that doesn't happen, you know, it's been some years since MERS, it's been some years since SARS, and it's easy to forget some of these lessons. If it's been 20 years, it's been 100 years, you know, since the 1918-19 flu pandemic. And it's hard for our institutions to prevent things, to put money into prevention for so long when things don't happen. And that's one of the lessons I hope we can learn. The communications part, maybe we will also be able to establish that kind of memory within our communities so that we can kickstart, you know, in what Mona outlined in this sort of optimistic view. So I certainly hope so, but I think there are some forces towards forgetting that we need to guard against.
Right. So Dr. Dalla, I put you on the spot with the first question, so I'll give you the last word.
Thanks, Andre. You know, I think in some ways, this has really been the golden age of science, right? The speed with which we were able to collectively identify the pathogen, sequence the virus, figure out how it was transmitted, produce vaccines. The pandemic has been awful, and nobody would have wanted the pandemic, obviously. But in some ways, there's no better time in human history for there to have been a pandemic like this. So I'm also very optimistic. I think one area where we've really gotten it wrong, both domestically and especially internationally, is the really thinking about equity. We've seen in Canada, of course, some communities have been much more affected by the pandemic than others. And around the world, there's still countries where vaccination uptake is way below 10%. And so I hope that, we come out of this pandemic with some real hard thinking about how we make sure that the benefits of science are shared across Canada and around the world. But I'm an optimist by nature, and so I hope that when the next pandemic comes around, the smart people will have written a bunch of reports, and those lessons will be there. And hopefully, next time we will be able to produce vaccines just as fast, if not faster, and share them around the world.
Great. That's a great note to end on. Science is important, but how we use it equitably, justly matters even more. So it's a great note to finish on. I want to thank the panelists again, Nur Fandala, Joanne Langley, Carolyn Colleen, and Mona Niemer. Thank you to the audience for being with us today. If you're not vaccinated, go out and get vaccinated, get your kids vaccinated. Those are coming soon. And again, thank you for being there, and long live science.
Thank you.